Hi there, my name is Raj Samrai and I work as a primary care consultant and pharmacotherapy clinical consultant with the Western Victoria Primary Health Network. Today I am going to be talking to you about managing mental health at the front desk. This is training for GP reception staff. It must be noted that it's not your job to decide if someone has a mental illness. That's the job of a qualified health professional. The training that I'm going to take you through today is designed to help you understand the way mental illness affects people, their behavior, and how they feel, so that you can offer the most appropriate and effective service. The learning outcomes: understand mental illness and its effects, improve communication with patients affected by mental illness, be able to respond effectively to challenging situations. Mental illness is a medical condition that encompasses a range of conditions. Some people are born with a genetic vulnerability, and then other factors such as a traumatic event, such as war, witnessing an accident perhaps, regular life stresses, and even drug use can trigger an episode of illness. What do you think this picture says about mental health? The three faces all belong to the one person. The middle orange face is the face that the world sees. Behind that, there are the faces of how the person feels on the inside, faces the world doesn't see. The face on the left, looking at the picture, is a face of someone who hears voices, of which may be angry or irrational. The face on the right is a face of sadness, a blue face, a depressive face. We don't always feel 100%, but life goes on and we implement our coping strategies. Seeing friends, doing something we really enjoy. Having a mental illness means that these coping strategies no longer work, and we have to see a GP to seek a diagnosis. The stress vulnerability model is a model in which the interaction between a person's vulnerability, their coping ability, and stresses they are exposed to determines whether a breakdown in normal functioning will occur. In this model, vulnerabilities are enduring, although changeable traits impacted by factors such as genetics, life events, and adverse interpersonal environments. Stresses are anything that challenge a person to adapt. Internal factors such as maturational changes, toxic substances, infection responses, physical responses to external stresses, and external factors such as bereavement, promotion, marriage, as well as daily hassles. It must be noted, the greater an individual's level of vulnerability, the less stress is required to trigger the symptoms of a mental illness. The water tank in picture 1 represents our genetic makeup, which is predetermined. Some people are born with bigger tanks than others, and they therefore have the capacity to hold more stresses and greater influxes of stresses before overflowing. Picture 2. The inflow pipe represents external stresses or risk factors, which are often beyond our control. For example, rain often falls heavily and gutters fill quickly during a storm. This is equivalent to being overwhelmed by stresses. Lots of stress all at once. At other times, rain is minimal, not much stress. At other times, rain may be regular and predictable, as is the case in chronic but manageable stress. Picture 3. The overflow pipe represents personal or protective factors, such as habits and learned coping strategies, or external protective factors like social support and employment. People with good coping strategies or strong external supports can control their outflow effectively to manage the stresses in their body, even when inflow is rapid and unpredictable. Others, particularly those with smaller tanks, might not be able to control their outflow and stresses will rise and cause overflow. Anyone can develop a mental illness, and no one is immune to mental health problems. Nearly half, that's 45% of the population, will experience a diagnosed mental disorder at some stage in their lives. Around 20% of adults are affected by some form of diagnosed mental disorder every year. This raises the question of those that are undiagnosed. It's interesting to note that the numbers do not add up. Why do you think that might be? The answer to that conundrum is that some people have more than one condition. Schizophrenia can be particularly disabling and affects approximately 1% of Australians at some stage in their lives. Depression is one of the most common conditions in young people, and at least one-third of young people have had an episode of mental illness by the time they reach 25 years of age. Up to 15% of people seriously affected by mental illness die by suicide, compared to approximately 1% of the whole population. A person with an anxiety disorder feels distressed a lot of the time for no apparent reason. Imagine something that has been very worrying for you at some time in your life. Now imagine feeling that way all of the time. This interferes with their ability to function. Generalized anxiety disorder, GAD, is often described as worry that is persistent, excessive, or unrealistic. The worry can be about almost anything. For example, money, work, relationships, health, being harmed. Social anxiety disorder, intense anxiety associated with social situations. For example, going to a party or going to work. Obsessive compulsive disorder, OCD. People feel compelled to act or think in a certain way to avoid irrational feelings of anxiety, including fear of contamination from germs, concerns with symmetry, compulsion to repeatedly clean. It's a coping mechanism to help them deal with their anxiety. Imagine how disruptive this might be in your life. Phobias, excessive worry or fear about everyday situations. That is, fear of being in the open, agoraphobia, fear of spiders, arachnophobia. PTSD, post-traumatic stress disorder. Anxiety disorder that can occur and develop after exposure to a terrifying event in which grave physical harm occurred or was threatened. Examples include war, a violent event. The person does not need to be involved in this incident. He or she may have just been a witness. Everyone feels down from time to time. Depression is a persistent feeling of sadness without a reason that cannot be shaken and affects the capacity to get on with your daily life. It's not a matter of how much of a substance they are using, but more how their use affects their life and those around them. In the 2013 National Drug Strategy Survey, it was identified that 2 out of 5 Australian adults drank at risk levels, smoked daily, or used an illicit drug, and 3% did all three, typified by recurrent social, work, mental, and/or physical problems. Treatments can include substitution therapies such as methadone and Suboxone, other medications such as naltrexone, and psychological therapies. Not just what people stereotype as a junkie, but lots of people from all walks of life have issues with problematic substance abuse. Bipolar disorder, also once called manic depression, characterized by severe low and high moods, often with periods of normal moods in between. Sometimes may drive recklessly or be very sexually active. Schizophrenia interferes with a person's ability to think, act, and feel. It is episodic in nature, therefore the person will have periods of acute illness but will feel generally well the rest of the time. Disordered thinking, that's everyday thoughts become confused and do not join up properly. This can lead to difficulty in thinking and communicating clearly. A schizophrenic may become delusional, false beliefs not shared by other people from the same cultural background and are impossible to change by logical argument. These individuals may hallucinate. The person may hear, see, smell, or otherwise perceive things that others don't see. Treatments are generally effective in reducing the effects of schizophrenia. Some people experience ongoing symptoms and psychiatric disability. Borderline personality disorder may include idealizing or devaluing other people, difficulty making compromises, marked impulsiveness, anxiety, depression, and intense outbursts of anger. May also feel dependent on others for their identity or afraid of being left alone. So often, these individuals make frantic efforts to avoid real or imagined abandonment. Persistent impulsiveness, including abusing alcohol and other drugs, binge eating, or gambling. It is important that when you are dealing with people with borderline personality disorder that you set clear boundaries. Myths and facts. Mental health only affects a few people. This is false. Mental illness affects around 20% of Australian adults every year. Most will have some form of anxiety disorder or depression. Mentally ill people are generally violent. False. Mental illness is associated with only a small proportion of the violence that occurs in society. Research indicates that people being effectively treated for a mental illness are no more violent or dangerous than the general population. People living with mental illness are far more likely to be the victims of violence and/or self-harm. People with a mental illness should be treated in hospital. False. With modern medications and treatment, there is generally no reason for most people with a mental illness to be in a hospital. If they are, a stay is usually for a few weeks when they are unwell, as with many other types of illness. There is now an emphasis on treatment in the community so that people can continue to live at home. People with a mental illness never get better. False. There is no cure for mental illness, but the symptoms are treatable. In most cases, a combination of psychological treatment, medication, and involvement in community programs and support can help a person living with mental illness live a relatively normal life. Schizophrenia means split personality. False. Schizophrenia has nothing to do with a split personality. It is an illness, a medical condition which affects the normal functioning of the brain, interfering with a person's ability to think, feel, and act. Some people recover completely, and with time, most find that their symptoms improve. There is no cure yet, but it is a treatable illness. People with schizophrenia find it hurtful to have their diagnosis incorrectly misrepresented as a split personality. People with mental illness are intellectually disabled. False. Mental illness does not affect intelligence and intellect. Someone who is acutely ill or has a disabling form of illness may have problems with organizing their thoughts and words, making it more difficult to communicate. Stigma. Stigma is due to misunderstanding as well as prejudice. Please refer to your harm reduction handout. Mental illness is greatly misunderstood, and those affected by it are often treated with less respect than is given to other people. You may often hear the term, that person is a psycho. The way mental illness is often portrayed in the media can perpetuate the stigma. The headline here is a great example of this. 1,200 killed by mental patients. What is meant by mental patients? How does it compare with all other deaths? Even using the word killed is very emotive. What do they mean? Murder? Murder accidental? Another example. If a person killed their neighbour, you will hear if they are schizophrenic, but you won't hear diabetic man killed their neighbour as the headline. Violence is often not present, and it may be only when they are suffering an acute psychotic episode that they may become violent. And they are more of a danger to themselves than other people. More violent acts are associated with alcohol use than mental illness. In mental health, we too often look through an illness lens and label people by their illness and neglect all the other factors that make them who they are as a person. For example, labeled as schizophrenic or drug addict rather than someone being treated for schizophrenia or drug dependence. People aren't labeled as hypertensive, but rather a person with hypertension. Most people can live and work in the community with their mental illness when there is ongoing treatment and support. Some may face challenges due to their symptoms or not receiving appropriate treatment and support, or stigma, prejudice, and misunderstanding out in the community. What do you currently do when dealing with people with mental illness? Discuss this within your group for about 2 minutes or so. People affected by mental illness often have their concerns disregarded or treated disrespectfully. Your body posture, gestures, expressions, eye movement, and tone of voice all contribute significantly to the message you give, so be conscious of this. This is also applicable in phone conversations, where people may jump to the wrong conclusions as they can't actually see you. Sometimes symptoms of mental illness can make it difficult for someone to ask for help in a straightforward manner. Ensure you make the effort to understand what the person's concerns are. If someone is acting offensively or aggressively, tell them calmly that their behavior is unacceptable and you would like to help them, but in order for you to do this, they need to behave politely. This is not intended to replace or conflict with your practice's safety procedures. Avoid giving advice on dealing with mental illness. This is not your role. This is the GP or other suitably qualified health professional's role. Sometimes some people with mental illness will experience delusions. Don't argue with the patient about the validity of these delusions. It is best to empathize with the patient that while you do not share them, that they feel real to them and move on to how you might be able to help them. Don't talk down to the patient or treat them like a child if they are not. Talk to them as though they are any adult of the same age. Treat with respect as you would expect if the position was reversed. Just because someone has a mental illness doesn't mean their concerns are imagined or less valid than other people's. Give them the same attention as you would any other patient's issues. You probably deal with patients who have a mental illness every day without realizing it. However, there may be situations when someone is more severely affected by symptoms. Sane Australia's Help Model. Please refer to the handout. Sane Australia is a national charity helping all Australians affected by mental illness. They help people improve their lives and reduce the risk of suicide, as well as providing education for carers, families, and workers in helping people who may be affected by a mental illness. Here, listen carefully and take seriously the concerns of people with a mental illness, just like you would with other patients. Using active listening skills, which focuses the attention on the speaker. Be sure not to interrupt. Giving the patient the opportunity to offload their concerns will help to reduce their anxiety. Give visual and verbal cues that you are listening and taking them seriously. That is, make good eye contact, nod, use encouragers such as yes and uh-huh. Empathize. Handling the complexities of dealing with a service can be challenging with people at the best of times, let alone when they have a mental illness. Sometimes people may experience or express their frustration at this in a way that might appear inappropriate to you. That is, challenging or angry behavior. It is important to reflect on some common ground that you agree on. This shows that you have heard what they are saying and are doing what you can to help. Show empathy by reassuring them that your knowledge and you acknowledge and understand how they might be feeling because of their concerns. You are not feeling sorry for the person. This is sympathy. Try statements such as, I can understand that when this happens, it must be very frustrating for you. Limit. Even though you have listened to the patient, expressed empathy, and offered your help, there may be times when they repeat the same point unnecessarily. This may be due to previous experiences, or they are used to being ignored or passed on. It also may be because of their symptoms or side effects of some medications may have affected their cognitive skills and they may be unaware that they are repeating themselves. Limiting techniques may be useful here, such as tell them that you understand and repeat the words back to them so it is clear to them that you have understood. State clearly that you have listened to them, and to be fair, now they need to listen to you. Speak calmly and clearly using short sentences. Try, I do understand what you're telling me. Now let's look at what we can do about it. Progress. As the condition or associated medication can affect cognition and communication skills, you may well need to repeat your questions or advice a number of times and or in different ways so you can ensure the message is getting across. To save misunderstanding, make it clear about what you and your practice are able to do to help the patient and what you are unable to do and why you are not able to do this. Often, people with mental illness feel like they get the runaround, so it is important to reassure the person that you are not passing them off. Communicate clearly in an honest, understanding manner. Do not crowd, rush, or touch the person. Provide a calm, safe environment. Move to quieter, more open surrounds if necessary. Remove any items with which the person might harm themselves or others with. Try to behave in a quiet, confident manner. If you act scared, could make the patient and others feel scared too. Be firm but friendly and unthreatening. Reassure the person that help is on the way. We are now going to discuss a case study involving James. We're going to discuss this as a group. Think about the help model as we have just previously discussed. How could you manage this situation effectively? Here, what do we think is really troubling James? You don't believe the staff have behaved in the way he describes. In fact, you know that everyone is quite sympathetic towards him. Would it be helpful to tell him that this is rubbish and untrue? What else could be going on for James? Could he have become acutely unwell and started experiencing acute psychotic symptoms of schizophrenia, such as hearing voices and paranoia? Empathize. How can you show James that you empathize with his distress? Even if his concerns are unjustified, try and empathize with how he may be feeling. I can see that the thought of this is upsetting you, might be one approach. Limit. You are not qualified to give him the help that he needs, but you may be able to assist him in getting that help. How might you do this? James, you don't seem your usual self today. Is there something going on? Have you felt like this before? Can I contact someone to help you? When was the last time you saw the doctor? Did you want me to see when I can get you in to see them? Progress. Follow up on what you have offered to do for James. It may be useful to debrief after a situation like this with a colleague or your manager. Mental Health First Aid. This is a 12-hour course. After completing this assessment, you qualify as a mental health first aider. This qualification needs to be updated every 3 years. The SANE Guide for Customer Service, SANE Australia. This is an extremely useful resource manual to help refer back to and to give new staff to read. Lots of great fact sheets on the SANE website at www.sane.org.